don't think anybody else is coming. We still don't have a replacement yet, right, Julie? For the board from the county board?
I'm sorry.
We still don't have an appointed replacement from the county board
We
yet?
don't. We don't have anybody from the county board, and we don't have a dentist, and there's 3 missing.
We lost Vic.
We ought to charge a staff fee for this to show up here, don't you think?
What's our quorum?
That's a great way to start it. A quorum is 5, yeah, sorry, I had her check. Yeah. Okay, I'm gonna go ahead and let Kathy in, so, sec, before we get started here. Thank you for setting this up. This is good of you.
You know, so when you asked about setting it up, I was just going, sure. I just asked her.
Well, and I wasn't for sure who we talked to the state's attorney, if it's the same people anymore, Matt or.
I don't think it's
Adam.
Matt anymore. I always reach out to Matt. You know, I'm always a little behind. I reached out for Joel forever, and he kept referring me to Matt. Now it's Matt, and I reached out to him, and he.
Is Joel still there?
Andrew. Joel's still there. and
Hi,
he's
Kathy, can you hear me?
Still fabulous.
I can, thanks. Thanks so much for making this happen.
Oh, you're very welcome. Okay, we're gonna get the meeting started. Everybody can hear you, I think. Sounds like speakers are working through, everybody can hear? All right, awesome. So we'll go ahead and call the meeting to order. And for the purposes of the roll call, Kathy is unable to attend in person today, so she will be attending via Zoom without vote, but will have the ability to provide input, and we have already contacted the appropriate personnel to make sure that that was not a violation of Open Meetings Act for us to be able to do so, as long as we have a quorum of voting members present and we agreed to allow this. So thank you all. So go ahead and let Amy go ahead.
Dr. Jones,
Here?
David Faith,
Here.
Kathy Manuel, Dr.
Kathy, that's
On,
you.
online.
She's here?
Yes,
Okay, she's here.
sorry, I couldn't hear that, sorry.
No, I understand. That's you.
Dr. Goodley,
Present.
Dr. Reichstack,
Here.
Dr. Peterson.
Here.
Thank you very much, and thank you, Amy, for setting up again the Zoom and for getting all of the packets and everything out to us and taking such great care of the board. I greatly appreciate it. So I'll move forward to approval of the agenda, which was sent to you in the mail and that you have in front of you. I'll entertain a motion to approve the agenda.
Move to approve the agenda.
Thank you.
Second.
Moved and seconded. Any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Then approval of the minutes. So we have the minutes of the June 25th, 2024 meeting. Those were also included as a part of the digital packet that everyone received.
Move approval.
Move to approve from David. Seconded. Any discussion of the minutes? Hearing none, all those in favor?
Aye.
Anyone opposed? And then we'll just include Kathy as saying for voting the whole time, if that's okay, thank you.
So she cannot vote virtually,
That's correct.
well, that could be changed, couldn't it?
No,
That's-
not
yeah,
without,
it's-
it's hard.
Oh, really?
It's a pain, and it wasn't needed, so.
Okay.
As long as we have a quorum.
She just wants to hear about the budget and stuff because we have to go to the county board. So,
All right.
But she can be a part of the discussion.
Yeah.
So, yes. Public participation on agenda items. Do we have any public participation on agenda items? Thank you. Correspondence and communication, Julie.
No, but Dr. Reefstaff, I've been thinking, setting it up. You were supposed to scream witch at me.
Oh,
Come on. It was- I posted something and it said, I was thinking, and the person screamed, witch! And he said, I'm gonna do that the next board of health meeting, and he forgot, so. All right,
It's
no
almost just
correspondence.
like Disney. I'm living vicariously through his photos.
Right.
That will happen. I will. All right, anyone else have any correspondence or communication to provide? Thank you. Underneath other business, our first line item is discussion of the proposed County Board of Health budget that you have in front of you. Woodcock from Champaign County to attend.
He had a family emergency.
Oh, I'm so sorry. Oh, thank you. So Mandy is here if we have any questions, Julie, on the budget. So I'll move to, we were gonna have Travis kind of talk about it from the county board perspective. But if we move on to the next items, those are all budget related, which would be discussion and approval of the proposed budget items. We do have proposals from Smile Healthy, who has got, we discussed that proposal at our last meeting for $50,000, which is included in the budget for our supportive services for dental health care services in Champaign County. And then additional budget request for dental practitioner recruiting focus for the upcoming fiscal year in the amount of $25,000. And then we also have proposal from the Champaign-Urbana Public Health District for sex education in Champaign County Schools in the amount of $30,000 to continue that program. And Whitney did give us an update about that program at the last meeting as well. So I will entertain any discussion of any of these items. And we have Lisa Killowy here, and thank you, Jennifer Henry, and Whitney is here. So if anyone would like to ask any questions, we do also have audience members here, guests from those agencies.
The question I had, and maybe I missed it, is the general support item request
General
for
support.
50,000.
You mean from Smile Healthy?
Budget request for general support for January 21st to 31st in the amount of 50. Is that Smile Healthy?
Yes,
Oh,
right?
okay.
That's Dr. Peterson.
Is it, that's Smile Healthy, yeah. Or Promise, whatever you want.
Okay, right, all right, okay, that explains, they just did.
Yeah, that's what that is. And then the other one was the one they had asked for. The other one is also Smile Healthy.
Right, dental
Promise.
practitioner, okay, that's good.
And then the other one is for the pregnancy prevention programming. Not sex ed.
Pregnancy prevention.
It's called pregnancy prevention programming. It's not called sex ed.
Oh, it is called pregnancy
Yes,
prevention?
it is.
Teen pregnancy prevention.
We have grants that are specific for AIDS education. We have them for sex education, but this one is for pregnancy prevention technically. Just depends on the name of the grant, but
Wow.
it's all the same thing. All the same thing.
Now, at one point, 2 meetings ago, I think, we did talk about the long-term funding
For the schools.
source for this
Yes.
program.
Yep.
Do we have any information on that or thoughts? No.
Not really an update.
Yeah, what we're going to need to do is just put together what the curriculum is, put together how much it costs, remind the schools that they are mandated to do something, and then take it into the different schools.
Okay.
And Mandy, did you want to talk about our conversations with Travis about the fund balance and
Yeah,
the
that's what I was
percentage?
gonna ask
I know
you.
that was another question that was
Yeah.
raised at the last
I
meeting.
can tell you what he sent me this morning. He said that the projected fund balance for this budget, with this budget, will be $498,757, which when I calculated that is 38% of the budget.
Before this budget?
No,
After.
after.
After?
Yeah.
Wow.
Yeah, and I had them do the projections, including if we funded everything. So that is the projection if we funded the 30,000, the 50,000, and the 25.
Where did all that money come from? I thought we were starting to worry about
Yeah, well,
drawing down.
yeah, we have been drawing down. I think one of the things that we were holding some money back from in that was we also didn't know what was going to be our percentage of the Carl suit, you know, and what we would have to pay back. in some of those funds, after that was all settled, and I think all of our portion has now been paid out, is that correct, Mandy?
OSF one, it's all paid out?
Oh, that
I
was
think for the
Carl.
county
Yeah,
part,
I don't
but
know.
I'm not sure exactly how that, because we still have, there might be some more.
Yeah, the Carl one I think is done, OSF I don't think
It's
is
the
done.
OSF one that just
And what was our portion of that?
discussing.
Um,
Do you
what-
remember what the county amount was that they owed?
She's not, she doesn't know off the top of her head, Kathy.
I would like to suggest that we take it to Carl, Dr. Eastack, hold your ears, take it to Carl in a giant check form
Oh, for, and to get the picture?
and present it.
Yeah.
A nice little photo op.
Contribution.
Yeah, here's the tax dollars that we can't spend anymore on
This will keep
services,
you
so-
afloat for another year.
So that was some of it. I know that we were holding, and had in conversations with the county board to hold some of that back. And so that part is, if that's been completed, then whatever was held back would have been put back in that fund balance.
And I think that they had a little bit extra this year too. It wasn't like every single thing was spent, is that correct?
He
There was-
kind of alluded to that, but he didn't really tell me anything.
Yeah, it had, yeah.
We,
It's
we've
a-
usually gotten an explanation sheet.
I know, he usually, like, the person who does it would usually be here to do that from the
Yeah.
county funds, because where it's a little murky and weird is with the tax assessment and all of that. And he, or prior to that, it was, Deb Busey or somebody, they would usually come in and go over that for the details of it. He did do it on the phone, but, he didn't give us anything, did he, like
No.
a paper?
Could we,
Is-
could we
is
be
this-
updated by email for that then,
Mm.
if there is a document?
Yeah, we could ask for that. So they were asking for clarification in a document, of the Carl and OSF expenditures. Kathy, that was the question.
Yes.
And so
Okay.
Mandy's been asked, to, obtain that
Right.
from Travis for a future meeting.
Okay, and maybe it's kind of that same question, but in the past, we've gotten, like the special revenue fund and the details of the, department summary of property taxes and general
Right,
government revenue, and it shows the fund balance. I did not see that. I'm wondering if we could get that again too.
Yeah.
That's what we're wanting to get from Travis.
Yep, that's correct. That's what they're asking for. And I think his intention was to bring that to this evening's meeting.
Yeah.
And my apologies, I should have repeated that. He had a family emergency and was not able to attend tonight. And I think the intention was he was gonna bring that to us tonight. And so we'll ask for that, see if we can get that via, email out to everybody.
Okay, we just want to have it before the meeting on Monday, I think.
Yeah, we can certainly see if we can follow up and ask for that. I don't know the details of his family emergency, whether or not that's possible before Monday, but.
I think he's responding,
Yeah, I think so, and the thing is, he'll be at the meeting too, Kathy.
He'll be at the meeting too, Kathy, on Monday.
Will you be at the meeting?
I will be,
You will be, okay.
yeah, for what that's worth. So,
Well, it's
lo-
definitely
been-
worth a lot, particularly when we started talking about sex ed that one time.
Well, that's true.
Pregnancy prevention.
Pregnancy
So
prevention.
Julie will be at the meeting, Kathy, along with you and Dr. Peters. We were just confirming.
Yeah, and, the last few years, it's been pretty decent there. You've gotten dragged through the ringer a couple of times, and I think one time, maybe it was Kathy also, somebody got, but,
Last year, they asked us to all come up, there were 3 of us sitting up there at one point to
Yeah.
answer questions last year.
last year?
Yeah.
Not last year. Last year, I think we didn't have to do anything, right?
No, we just
That was
sat
you.
there, I would, yeah.
Oh,
because
we
the
were
last-
doing the question
Oh,
of
that was the other
substance
meeting, sorry,
issues
my
and-
apologies.
Yeah,
We had
no,
another
the
budget thing
last,
on
at
the
least
substance
two,
stuff.
the last 2 county board meetings that Kathy's been to with me, or me with her, have been no questions. Travis, or whoever, the person in that spot, now it's Travis, will report out the budget, and if they have any questions, we'll be there to answer. So,
Well, the county board has gotten really quite interesting
Yes,
lately, and so
I know.
it may not be as smooth as it was before.
The other thing we've had sometimes in the past, and again, I depend on Travis's situation, is they've sent us the slides ahead of time that Travis uses to present, and it would be good to have that.
Would you ask Travis for the slides he will present for the county board? It's usually only one or two.
Yeah, we'll ask for those
Yeah,
as well.
just a couple, right?
Yep.
We'll ask to review those as well.
The other thing that we've gotten in the past from public health is a listing of staff and assignments to our program.
The
You mean
what?
the budgetary personnel?
Yeah, the programmatic personnel. So we've gotten a breakdown on who's assigned to what program.
Well, you know it's percentages now, because we don't have specific staff for the county. There are no county staff, and
Mhm.
so it's just a
Are you
percentage.
talking about the personnel? Yeah, I noticed that you didn't include that, but it's
You have
on
it?
there. It was included.
It was included in the online?
I don't know,
That was in your email?
yeah.
No,
The
it wasn't.
details on the thing that you.
She's saying they didn't put
So
it.
yeah, it's the second sheet of these, I know what he's talking about. So the what we're referring to
It might have been
is that when we get a copy of the budget, it usually there is a list of personnel that's included in their percentage
Right.
allocated. So Dr. Peterson was just asking for,
I
Yeah.
can forward that to you.
so in the same email, we'll try to gather the information from Travis, we'll also forward that information.
Right.
If you can-
And that value stayed the same, it was just a 4% increase.
4%? Is that what the county has been doing? That's what we're doing.
I don't know what the county's doing, but that's what we do.
Overall, for the whole, that was the raise.
All personnel.
All persons.
So all personnel receive a 4% raise.
Yeah.
What's the percentage increase for the rest of the overall budget? Is it percentage increase?
Percent increase for the rest of the budget, the overall percent increase.
Expense.
you know?
So I don't remember that off the top of my head.
Is this
It
down
gave
at the
me a
bottom
number
here?
of years,
Down at
but
the
we
Yeah,
had
that's what I was
roughly
looking
that.
at, if it's the 24 versus 25 at the bottom, negative 1.7%
Yeah.
So it's a
change.
decrease.
Well, that's the overall budget change, but the property tax went up.
Property tax went up, right?
Yeah, I just don't remember the percentage of it, but it was definitely more than that.
The increase in the expenses we're approving in this budget is not negative.
Correct.
It says, I see the negative 1.7. That's not.
It's a contract.
We lost some COVID money we still had last year, so the budget went down a little bit because of that.
I see.
So even with taking that out then, Mandy, and if we fund the 3 proposals that we have, will there still be a negative in the budget? I think that might be.
Not a negative in the budget. Well, I mean, it is because you're authorizing additional payment out to come out of the fund balance.
But when those get figured back in, my question is, when those get figured back in, will we be at an even budget or in a positive situation as opposed to a
It
negative?
should be at an even budget.
Okay, thank you. I appreciate it.
What was her answer?
It should be an even budget.
You mean breaking
Yeah.
Breaking even.
expenses equal? That's what you mean by.
That's what it shows on my sheet right now, right? Total expenses with Smile Health is exactly to the penny, the same thing as the total revenue plus the fund balance transfer.
Yeah, we're looking at the negative of 1.7, and that's related to the COVID monies
So there's the 5%. It's the 5%.
on the
5%.
first page in
Oh,
the
I see,
third
yeah.
third
5%
column. Yeah.
increase.
So we were just wanting to make sure, as we go on Monday, we're not approving negative balance.
That's the 5%.
Did they say, what's the county ERP? It's also, it's only $1,500, I just didn't know what it was.
That's the county ERP.
That's their accounting system.
It's their accounting system.
Oh, so we're paying a piece of the accounting system. Yeah,
Pardon?
It's their accounting system and we pay a portion of that.
Okay, we haven't in the past, have we? I haven't seen that before. Oh, yeah, we did 1,500, never mind, yeah, we did.
Are there any other questions? Any questions about any of the proposals for the individuals that are here that have put forth those proposals?
Got a lot of discussion coming up to this point.
Yeah, I appreciate, thank you to both programs for providing that
So
information last meeting.
as we approve this, we would be approving the 3 requested items because they're in this.
They're in there, correct. So if you want to change something, she put everything in there. So if you want to change something, then you need to tell her before we go to the county board
I
meeting.
get it.
I just asked for it to be done that way.
That makes sense.
No, it makes sense, yeah, especially with the carryovers still holding up. So.
Any other questions?
Seemed like at one point we had a lot of discussion, if I can even raise this, a lot of discussion about recruiting, and there was some good information, right? I don't know if that's up for discussion at this point, or if there's any update we can, it seemed like we had a lot of questions around that dollar amount, and how it was being used, and how effective it was.
Yes, yeah, the 25,000, yes,
Yeah.
it's in there, and Lisa and Jennifer are here. Did you have a specific question, Kathy, on the recruitment dollars? Are you asking about how it was spent last year, or how it's gonna be spent this coming year?
Maybe how it's gonna be spent this coming year, and what the situation is for recruiting, what they're recruiting for at this point.
So she's interested in knowing the $25,000 for recruitment, how those funds will be spent specifically over the next year, and then any updates on any successful recruitment that's happened to date.
I would love to get an update on successful recruitment, it's just difficult. So every FQHC across the country is recruiting, so the competition is stiffer. We had a candidate the other day that was interviewing with 12 different locations. So it is hard to find. But that being said, and so we have upped our game with our sign-on bonuses, with covering other types of expenses, just casting the net further, bringing them in from farther away, not delaying to where we can find a cheaper airfare, but just saying bring them when we can. Even our staff that participated in interviews, they're
I
off.
can't hear her, which is fine, as long as the rest of you are hearing it.
Okay, my sincere apologies, so, no, you're fine. I'm so saying,
That's okay.
do you wanna come up, do you both think we'll come?
Ask.
Yeah. Oh, yeah, I don't know where to go.
Could I sit behind the desk and join the group?
Here. Thank you.
Hello, okay. So I was just talking about the difficulty with recruiting because while we always think we have in a very attractive package as a federally qualified health center or an SQHC, there are 1,500 FQHCs across the country that are all recruiting. And so we had a candidate the other day, and I loved that he was forthcoming, in 12 different interview sites. So it is hard to stand out when it's that because we can all offer some of the same. So we have upped our salaries, we have upped our sign-on bonus, we have upped on how much we'll cover if we can support an H-1 visa or.
Have you offered basketball tickets?
There's the thing. I was just thinking, I wonder if we could get like ballet tickets or something. So it is, we sell the community. We don't delay. We used to look and try to work around and see if we could get a cheaper airfare because it would be so expensive that maybe we can fly into Bloomington, someone can drive to Bloomington. We don't even do that anymore. And if anybody on the interview team is in town but just off, and that's the day we're bringing them in, sorry, I'm bringing that team back in. They're coming off on vacation because we just have to be time. So it's been very, very difficult. We also have, we're going to try again, we did it once before, but we have crafted a letter to go out to all of Champaign County dentists to see if anybody can give us a day, half a day, once in a while, every once in a while, Saturday or something, to help with that. But we do have an offer out, as a couple days ago, for dental hygienists, so fingers crossed. And then we're also paying for, if they come to us and don't have the public health certification, then we're paying for that too. And we're paying for them, I think it's 30 to 40 hours, don't quote me, for the coursework. We're paying them at their very high wage just to take the coursework so that we can get them in and get them certified. So, we're
So
trying our best.
how is the 25,000, how is that intended to be spent? And I guess I'm looking for, you talked with us a little bit last time about how many practitioners you have, but really what the goal is this coming year in terms of what number you're trying to recruit.
We're still, it depends on a few things, but one is the ratio of our dental hygienists to dentists. So we think at this time about 2 to 3 dentists, but if we're successful and can continue to find dental hygiene, then we're trying to do a ratio of 2 to 3 hygienists to 1 dentist. So we're trying to keep that up. We don't want to get too heavy in the dental hygiene and be able to have lots of good clinics in Rantoul for dental hygiene, but if they, and everybody they see, we don't see anybody that would say, you're good, we'll see you in a year. They have things because they haven't had dental care. But if we get too much of that, and then the dentist can't keep up, so we have to be worried about that. But we're in that 2 to 3 range for dentists, and then the associated dental hygienists that go along with that. So if they fell into our lap, we're not gonna turn somebody down. We have the ability to do, we've written for a grant to help us perhaps with some extended hours and the Saturday hours, because we think patients could, come in on a Saturday. And if that's the case, then we can run some longer times and be more creative with the schedule and bring in more dentists and dental hygienists. So the demand is so great, I probably could never hire enough to meet the demand, it seems. So we will continue. If they fall into our lap and they come in and we can make it work, we're gonna hire them.
So is this 25,000 the total of your recruiting budget, or does this just add to your?
That just adds to it, right? There are all these other perks that we offer to, that we're covering, and with some we're helping with licensure. Whoops.
It's saying the meeting's gonna end.
Oh, sorry. Some, especially new grads, don't have the money for moving expenses and housing and all that. So we feel like if we can help them with that, then they'll be more likely to come to us. So, I keep telling people on my team, maybe we should come and clean their houses too. Can you take the first week they're here? And we're just trying to be as creative as we can to be competitive and bring people in because they have choices.
Thank you so much, Lynn.
Yeah, I have a question for you. So in this, let's say in a typical recruitment cycle, how many people actually come to Champaign?
It always depends. Sometimes we get rapidly, we'll have 3 candidates and then we'll go through a dry spell and we're not getting any, so it just depends. And I'm not savvy enough to know what the cycle is for when they're starting to graduate.
Right. Yeah, I guess so. Just so in a typical year, if you're casting a big net, but the actual number of people you come to Champaign are a dozen, 10?
I would say 6, but
Half a
they
dozen.
would have to be so awful to not bring them on site.
Gotcha.
So everybody that we talk to is truly highly potential. And it's hard to get to know somebody off-site. You really have to bring them on and show them around and say, this is how we're doing it, and meet the team and have a conversation.
Sure.
So it would be a rare case for us. Now, a little different for medical because we have a little more choice there, but for dental. And it's not that we want to accept any one body. It is hard to be a dentist in our program and do public health service and dentistry. So it takes a special person, but we're not going to turn somebody away until we fully vet them.
Did you say 6
About 6,
per year
yeah,
that are visiting?
yes.
Yeah, we can vouch for it, it's hard, right? Whitney and Jennifer,
Yes.
it's very hard.
I feel like last time we talked about this, you said you actually had a harder time recruiting hygienists than dentists. Is that still true, or is it?
It's probably
Is
as
it waxing?
bleak for both, it waxes and wanes.
Okay.
We feel fortunate that it was a dental hygienist, and we're like, yay, she's experienced, and it's gonna be great, and she's like, I wanna do this, and I've been waiting for this person. Oh, my husband just got cancer with kidneys. Oh. So it is these highs and these very low lows, and so we go out. So we're thrilled this week. Another one just kind of fell into our lap, And they have to really want to do this. If you come from private dentistry, this is a whole different ballgame. And it's different. And so we try to be, to recruit wisely and to be very transparent with what it looks like. It is not private dentistry. It's different. And we're not turning anybody away, and we don't care if they're late. We're going to fit them in. We don't care if they're rude. You just go. So it's Easter family.
Thank you for that.
Thank you so very much. Appreciate it.
Thank you.
So very kind of you.
Sure.
And just for clarification, I think in last year's budget, we have the 50,000 for Smile Healthy, and we initially had another 50,000 in for recruitment. This year I can't remember if that's where we ended up. This year we have
We cut it.
25,000 in for recruitment. So I'm trying to remember whether we reduced that by 25,000. I think,
We had a discussion and halved it.
we did.
Yes.
Yeah, yes, we did reduce it.
Uh-huh.
Yeah, okay, that's what I thought, okay.
Any further questions? Yes, please, thank you.
Move the recommended budget.
Moved, the budget has been moved with all of the allocations as described and discussed.
I'll second that.
Thank you, Dr. Peterson is seconded. Any further discussion? Hearing none, all those in favor?
Aye.
Aye.
Anyone opposed?
Just doing parenthetically, I'd like to, I've been on the board for a long time. It didn't used to be this easy.
It did not. I will vouch for it. It did not. It was horrible. Horrible. PTSD, thanks for that. Yeah.
Thank you all
We
for,
just keep
you're
getting
welcome
better
to
and better
stay, but
people.
thank you so much for that.
Thank you so
For
much.
providing that information, we greatly appreciate it.
Are there questions over our reports that are next?
The reports are next, so yes, let me get right to those, thank you so much. Next item on the agenda is the monthly reports for Smile Healthy for June and July, and I want to thank your team for getting those to us every month and making sure the county board is included on all of those, so I greatly appreciate it. Any questions for Smile Healthy on those reports?
And we got them in early, but we were so excited. We did a dental back-to-school exam August 10th in Rantoul, and we had, how many dental patients? 26 kids, so.
Wow, that's great. I will entertain a motion to place those on file. Moved and seconded by Dr. Epstein. Any discussion? Hearing none, all those in favor?
Aye.
Aye. Anyone opposed? That passes. Thank you both.
Thank you. Oh no, you're staying till the end.
More than welcome.
Part of the public.
Approval of the invoices payable to Champaign County Access for Child Dental Access Program. So this is to approve the invoices for the reports that we just received. So that is items 3 and 4. So entertain a motion to approve.
Motion to approve?
Moved and seconded. Any discussion? Hearing none. All those in favor?
Aye.
Anyone opposed? Thank you. That takes us to the invoices for the health district. We have invoices for services on May and June, and I just want to also say right here, I so greatly appreciate everything that your staff does and being so public and transparent with all of the visits and services that are provided here and placed on the website. That's rare in most counties in Illinois, and I deal a lot with data, and I'm always asked, how does your county always get this stuff? And I always give them your name, so I don't know if you get people that are contacting you and asking,
I will tell you
questions,
that
but-
it's going to get a lot better, even.
This is good news then.
Because that's a whole nother discussion, but we will be having dashboards at some point that are going to be really usable to people writing grants or writing reports or things like that. So we're getting ready to take a leap into the next level. So
That's great. So whether you're writing for Robert Johnson, or you're doing some state, you're doing some, federal HRSA stuff, it's all the stuff you always have to have, and it's so hard to get from any other county.
Yeah,
So-
Rob is very good at finding anything. All the division directors know their own program data too, but I text Rob a lot of times for just weird requests that I get from places because I don't even know where to look.
So Rob's the guy.
And yep,
Okay.
he's the one, and
If
he
I
will
come
find
across
it.
something, I'll write it down so I can.
He keeps
look
it,
at
and
later.
he knows where it is, and I, literally, any weird little thing I come across, I send to him. He's my medieval filing system. Actually, all the directors are.
Well, thank you, and I'm going to talk to you about teasing out zip codes for rural health data.
Okay.
Because the couple zip codes here tend to always throw us out, and we have a much more impoverished population, I think, in the rural areas that people tend to notice in our counties.
Oh, he can do way more granular level than we do, but you just gotta be careful with that because of the,
Yeah.
like if you need something for a report or something, or a
Right.
grant, but.
Yeah. Okay, so motion to approve those invoices for May and June. Moved, do I have a second? Moved and seconded. Any discussion? All those in favor?
Aye.
Anyone opposed? Thank you. And then our next is under CPHD, item 3, approval of Champaign County contract between Champaign County Public Health Department and the Illinois Department of Public Health for public health emergency preparedness, build and sustain emergency preparedness capabilities in the amount of $62,726 for the time period of June 1st to June 30th. And just as a reminder to everyone, as we discussed previously, we have to always approve these now independently. That's new. We had to start doing that last year. So even though, yes, some of these things are included in the budget, for the contractual grant purposes, they have to have a separate line item. And so that's why we're doing that independently.
And I'll move it, and then and when I get a second, then I will have a discussion.
Second.
Okay, moved
Okay.
and seconded. Dr. Peterson?
This is again the thing with 95% of the 60 pages is just boilerplate, isn't it?
Yes.
Can-
You mean
can-
of the contract?
Yeah.
Yes, it
And
is. And
Can we avoid reading the boilerplate, or do you think we should just, it's now digital, so I
It's-
guess we're not wasting paper.
So these grants come in, and you're right, it's all the same stuff. They used to do it differently, but now it's paperless, but it isn't.
It isn't,
So-
yeah.
But it isn't the same stuff. The only core of the grant, there is the little specific part of the grant on all these it's just a couple pages. The rest of it is all the lawyer-ese that we have to go through, that we have, had to have somebody go through it at one point. And then we always have to make sure there's nothing weird that they tacked in there, but it's just the same stuff. If they put something new in there, they let us know.
Yeah, and what I find too, I mean, probably, I don't know how many I've read, I do actually go through it. I don't read it closely when it's
Right.
boilerplate, but the title page doesn't even say what it is.
We've
So
men-
the only
we've
way I
mentioned
can tell
that
what.
before. We've mentioned that before too.
And the o-
Try being me when they're all flying at me and I'm like, what is this? What is this? What is this? Because it does not say, it no longer says like the name of the grant.
It's a footnote.
Yeah, it's just a whole different thing, and they're online now, and it's just, but the thing that cracks me up is that it's supposedly a paperless system, but then they will, we'll get it all done online, and then somebody will say, you didn't send the hard signed copy, 89 pages. It's like, how is that? So.
Okay, so it's not just me, I mean.
No,
okay.
and they have gotten so much bigger. Because the grants that I used to do were like maybe 10 pages. Maybe. And it was, but the most of it was talking about what the actual grant was, and then you had your lawyer things at the back.
So what I also had trouble with, and it could be, swimming in paper and didn't find this, but I didn't really know what the deliverables were.
Well, this is this is the emergency preparedness grant. So that's the other thing, that never shows back up, does it? Like when you guys fill out the grants online now,
They put it in the, like, the very last couple pages, and like appendix E or something like that is where all the performance metrics, deliverables and everything are.
Yeah,
It's at the very
I
end.
think it's buried.
yeah.
Buried,
Yeah.
okay.
But,
when we
but
put
they
in, like,
have to put it in the
applications,
applications. So all of that stuff goes in those, and then they have to go through the whole system too, and be approved on this end, and then go in, and then they doodle around with it, and then it comes back to us in that form that you see. So, yes.
I will look for the deliverables.
Well, the deliverables are, you want to just real quick say, kind of not the actual deliverables, but what are the grants do? Because we, of course, get one for CU, and then we get one for the county, so.
Yeah, so participation in the Regional Healthcare Coalition, and that's spearheaded by Carl. It's hospitals, local health departments, fire, EMS, that plan for public health emergencies in the region. We have an annual exercise requirement that we just focus on here internally. The focus this year is preparing administration, so our like section chiefs and it's in the context of the new CBA, so we got to prepare for that. Drills, maintenance of equipment like radios, things like that.
And that is in what I thought I read?
Yeah.
Should be, and the training as well for staff.
But it might say something like, command and control training or something like that. Did you see we have another 5-day of that one? If you haven't really lived until you've been through that one of those.
Okay, all right.
5-day training with all the police and fire and other people. It's like,
I appreciate that answer. Somebody at the state probably ought to recognize that it would make a lot more sense to have a cover page.
you know what? I spent weeks trying to explain to them that when they made me if I did not select Ms. or Mrs. or Miss or Doctor, I could not further the grant when I was signing it. And it said it was a prefix. And I said, you have it listed after or suffix. I'm like, it's a prefix, but you have it at the end. It took them a year before they got that, so where it wasn't default. Like literally, if I did not pick Miss or Ms., it would not go through.
Wow, okay.
So it's that kind of crap. It's
The university grants are the same way.
it's just, it's
First
all
at
just,
HRQ, then they're all,
like, computerized IRB about makes me want to curl up in a ball and cry. I can't imagine what that's like. It'd be so bad. Okay, but yes, it is not just you, but thank you for bringing that up because I have been feeling extremely ancient lately. So I appreciate somebody noticing it and thinking about it too. So, because yes, why don't they just say what the stuff is without it being a gigantic packet of crazy?
It's like taking all the labels off of canned goods in your cabinet and then figure out what everything is, you just gotta open it.
I actually did that as a child. We had a pantry, so I won't get into that, but let's just say I was in a lot of trouble. And we had 7 kids, so.
Oh, wow.
Is it gonna be peas or peaches? We never knew. That went on for a very long time because it was a big pantry. That was back when Aldi only sold canned goods, so we were stocked up big time.
Oh, wow.
Mhm.
It's like a really good children's book.
I was thinking the same
Yeah,
thing.
it's a really good
Yeah.
children's book.
It's a really good, like, COVID story too, that's what they do with COVID.
No, I just thought about COVID language. That whole era, 2 years, it's just nausea. I don't have any explicit memory of months because it was just the same. There was nothing distinguishing anything going on.
It was pretty eventful on a daily basis, I thought, for myself.
It's all coming back.
Yeah, we're having a rough time in the summer, but people aren't dying by times because luckily a lot of people are
Just getting sick.
vaccinated, but there is a lot of it. But the new vaccine that will hopefully be here next month will be a good match, so that'll give us another while.
So, I'm sorry you brought that up because we get into COVID discussions going. So I was listening to, it wasn't NPR, but it was Sirius 120, which one is that? BBC or something.
Mm-hmm.
There was this long discussion about there's these capabilities to make some really effective vaccines, but the discussion was that nobody's really driving them to produce them because there is.
Welcome to public health.
Yeah, well, but part of it is because they were saying that, yeah, they could produce them, but at this stage, they're not sure people would take them.
Yeah.
And so you could make them and you get them and we give them to public health, but nobody, and
Nobody showed up to the party.
Were they talking about H5N1 for those vaccines?
They were talking about a number of them,
Yeah.
but just basically the capacity to make these more effective vaccines. Because right now with COVID,
Yep.
like, everybody's at least had one or two, but, whatever the newest variant of it is not really being effective for those, and people are contracting it like they would any other virus, but they're not going to hospital, they're not dying per se, but there's still some cases of long COVID, and I didn't get if that was with the new variant or the old variant, but at the end of the day, if they have more out, is it, like, what is the strategy, or have you guys thought about from a public health standpoint, do we bring it in, are we gonna bring in, or would you bring it in, and then how would you get it out to the community in hopes that people would take it, but again.
Well, we're already gearing up in the community for this next month when we hope that the new variant, the new COVID with the new variant in it, which should be a lot more effective. Then the idea is that then every year, we have a new COVID vaccine and a new flu vaccine because they're both going to have to be changed every year, same deal. They're going to both be mutating constantly, so they're both will have to do the same kind of thing, and it'll be like it was, or it is with flu. Get lucky most of the time, and it's a pretty decent match. But if not, then we have a bad flu year.
Walgreens is saying September 1 for
No, later in September. I don't even think it's totally through the process yet to be approved. I don't think it's been through ASIP yet, but it will be, and it's a good match. So, and then flu shot will be out, so keep taking them. I mean, we'll just keep doing the same thing that we do. We have people calling me. I get calls from people, when are the new shots? That's not a usual health department experience. They are not getting calls for those, but we do, which is good. So, I just try to put stuff out on, Facebook every time I hear something new so that people can know that it's coming and that so far it's looking good. But yes, one of the big problems in general with vaccinations is that we don't have, drug companies would rather make Viagra and Ozempic and all those things than they would something like vaccinations, even though.
Well, when they were getting federal money, they were happy to.
They were happy to when they were getting federal money, but then it stops. We could have a lot more vaccinations for a lot more things. It just makes sense, the things that, and the mRNA platform is a really good thing to have too, but are there going to be people, do you mean because people won't take them? Because, that little problem will eventually work itself out.
The uptake on the flu vaccine is something like 50%, so
Yeah.
That does make a difference in the
And
community.
Yeah, it definitely does. And, we have, in general, our schools are highly vaccinated still. So, in Illinois, we have the vaccine laws in schools and things like that, and they're pretty highly vaccinated. So, we don't want measles here, but we're also not going to completely freak out about it unless it's in an unvaccinated group. But, we have a high percentage of vaccinations pretty much. Enough in the schools anyway to keep some of the outbreaks down. We'll see, Rob. But there's, monkeypox is on its way back, swinging back around, and it's gotten uglier, it's gotten more deadly, so, all those things. But we do, just for the record, we do have if it comes back, I don't know what population it might come back in, but if it comes back in men who have sex with men, we have a decent vaccination rate in the community for that. Because people took it seriously and got vaccinated. Not so in other places. But we don't know, now it's on this path, the same path that HIV went in Africa, which is along the trucker routes and sex workers. And so now it's getting out of the country and it's gotten deadlier, which is sort of weird. It doesn't usually they get less virulent, but this one has.
Yeah, communicability is not necessarily
No.
in tandem with virulence.
No, not at all. It's
They might be
usually,
separate, yeah.
it's usually different, but I don't think this necessarily spreads any differently. It's still it's still contact, so it's still sexual contact and it's household contact. So kids are getting it also directly from animals and dying from it. So.
We're always gonna see an uptick in a couple of weeks anyway, because
Always.
70,000 individuals are headed back.
Well, they were here today. It took a lot longer to go down.
A
to
few,
Canada.
not
Be around
Not
campus in the
anyway.
next 2 days.
Yeah, it's gonna be
Move-in
different.
days approaching.
There we go.
Okay, so we had that moved and seconded. Discussion, any further discussion?
Wow, we really went on a tangent on that one.
It's a good discussion.
You could have wasted more of our time on the budget than we wouldn't have had,
All those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you. All right, one more group of things here to put on file. CUPHD reportable disease reports and performance management reports. I'll entertain a motion to do both of those together if you'd like. Moved. Do we have a second? Moved and seconded. Any discussion?
Just one piece of discussion. I did read the communicable disease. I cannot get into the other one, but it's password protection.
Performance management?
Yes.
That is a good point. We do, so I agree, performance management, tracking system reports, I can share, see if we can put those in a file on OneDrive and make those publicly accessible. But for the performance management tracking system, you have to have a CUPHD username and password.
So we're putting on file something we can't read.
So I'm saying
Yes,
we
you are.
could put something on that file.
Well,
but-
he'll do a report for it, because you
Okay.
don't need to get into the whole system, because
Yeah.
then if you doodle with it, it might stay in there, right?
Well,
Because it's
let it
actually
read
like
only,
a-
make it read only.
Yeah,
Yeah, we could look at doing that too.
don't be getting all fancy with me. If you read over
Well,
mine.
I'm old, how can I be fancy? You do it in Fortran, and I'll keep up.
I remember Fortran.
I don't know that one.
I was just, so you can just do a report for us in the next, thank you very much, just wanted to clarify that, thank you. Okay, moved and seconded, any further discussion? All those in favor?
Aye.
Anyone opposed? Thank you. Whitney, thank you for being so patient. So our last is updated county sexual health education program.
New school year, very exciting. We will be in JW Aider with the 8th graders, and Promise just opened a school-based health center at the junior high school, so we're hoping to be able to refer kids over there for medical. They don't have dental over there, but if they do, we'll definitely refer kids over there for that. Thomasboro, Ludlow, and Gifford are also on our radar for this school year. They're all feeder schools into Rantoul Township High School, along with Fisher Junior High, the 8th grade class, and then Fisher High School in the 9th grade class, and then Heritage High School, which is partly in Champaign County. Yes, so we've got some new contacts this year that we're hoping to be a little bit more successful with.
Great, I was hoping that they have a new principal and a new school nurse.
Yes.
Any questions for Whitney? Thank you guys for all the wonderful job you're doing there. Great work. Any old business? Anything anyone wants to discuss?
Well, not old business, but I've got a suggestion maybe, and if people are interested in it, if not, that's fine too. You know, in terms of the digital that we get, Dave printed this out. It would be nice if we could do a digital display on the wall or something like that when we get into issues about what's in the packet, that we can actually look here at the,
We could do that, we could just put this stuff this way, yeah, put it up on the TV. All right. We can do that, and instead of putting it on there, you can just go into that and show it. Okay, that's doable. Don't know how to do it, but I know it's doable.
It's also,
well,
We're just using.
it's already digital, so it's be pretty easy
it's
to
also,
probably.
as long as we're on that kind of thing, as I've said before, especially when there's not much public, and we had some tonight, but I would prefer that the tables be across from one another, so that I'm not.
Oh, okay.
When you get older, your neck is
I
stiff,
get
right?
that,
Yeah.
and I don't have my hearing aids today, so it's a discussion more.
Yeah, okay.
I've always thought that.
Just put it in a little square.
We did it.
Yeah, like a U-shape.
I made the suggestion like 3 years ago. and
We've done
got
it before.
Okay.
For sure.
But then I know that you gotta figure out how the public fits into that, so.
Well, there usually isn't public. I mean, everybody that's here is either here to answer questions, pretty much to answer questions, so.
Like a U,
Yeah,
people
you
on the
and-
side,
Mhm.
something, so it's more of a discussion.
Those are both great suggestions. Public participation on non-agenda items. Our public, Kathy has left. I know you can't see them, but we still have Robin and Randy here. Thanks for hanging in there with us. Yeah, they are providing great energy.
They're keeping us honest. is what
They
they're
are,
doing.
I appreciate it. Hey, I'm always for that. Always for that. All right, our next meeting is November 19th at 5 o'clock. I'm just double checking, is that date still work for everyone?
Before Thanksgiving.
So that,
Yeah, because I know it comes closer to a holiday, so.
19th, you said?
November 19th. I know we set these a year in advance and then things, life happens, right?
It's about half the time it does.
So yeah, I'm still good on the 19th. Kathy, are you still good on the 19th of
I'm
November?
gonna be out of the country on the 19th.
Kathy's out of the country.
Well, we could do Zoom from out of the country too.
They're talking about zooming you in, Kathy, you've created something here now.
I'm not gonna be available that day, unfortunately.
Okay,
so Thanksgiving is the next week.
Thanksgiving's the next week, that's why we did it the earlier date, because Thanksgiving's the next week. We try to avoid Thanksgiving.
The next week is the 26th.
Yeah, which is when we
Yeah,
normally do
that's,
that.
that gets to be-
We decided to move it up.
Thanksgiving week, you mean?
Yeah, that's why I was just double checking.
I'm actually available that day.
Yeah, so we can't really go back. So we have 6, quorum is 4 of 6, so we need 4 at minimum. But we anticipate that by November, we will have a county board member, so that will make us 7.
I think, yeah.
Which then we would need 5. And we have lost,
Well, Vera
Two
Weiss was
members.
a physician,
Dr.
right? She
Vera.
that was a physician spot, yeah.
we have a physician and a dental spot.
But we've got 2 physicians on.
Yeah, I know, but I mean, I was just commenting on,
Yeah. So we could take a member of the public to fill her spot.
yeah.
I can't speak for him, but Barry Howell just kind of retired.
Forget it.
Maybe he would be
Who's
free
that, I'm so
to-
sorry.
Sorry.
Dental Society.
Barry Howell,
Barry?
who was the president
President
of
of
the Dental
Dental
Society for a
Society
while,
forever.
stayed,
Yeah, long time practicing dentistry.
Mhm.
yeah, good guy.
Well, yeah, I know that Eric Eric from the county board, Forson, has been looking. I guess he got appointed to go out and try to find a dentist, so he told me, he saw me at something and told me he's really working on it, but so far no good, but
You marry a call.
I will do that.
Would Kara, does she wanna come back, or?
I,
She's
you
a
know,
long time ago for her husband,
I doubt it, because, she may work for us part-time at some point.
but,
She hasn't wanted to yet, but she said she would be like a PRN, so if she did that, I'd probably be weird. Probably
Yeah, no, I
not,
get it.
okay. Well, it probably actually would be okay, because we don't
Yeah,
see county
it's
kids.
a different unit of government, yeah.
oh, yeah, it wouldn't be a conflict.
Yeah,
Yeah.
well,
I mean, reach out to her,
mhm.
because she always talked about a long time ago that maybe when she left, she might do this part, but.
Yeah, because she
you know,
knows
then her
what it
husband
is,
did.
yeah.
Yeah. Sorry, Kathy, we're just kind of talking about people. So, if we moved it, okay, so if we have 2 out, then everybody would need to come in order for us to have the meeting, because we would need 4 of 6 as we stand right now. I don't know if we'll have more people by then. If we move it, we can't go back because of Thanksgiving, we'd have to go up. So then we would be moving it to November 12th.
12.
What is everybody's November
That's
12th look
fine.
like?
Yeah, that's fine. For me, yeah.
As long as we have 30 days, I'm okay, right?
Yeah, oh,
As
yeah.
long as we give 30 notice, okay. So we're
Yeah.
not breaking any rules.
I'll be out there.
I'm still gonna be in my out of the country.
Oh, you're both still going on the 12th, okay.
Oh, that
Um,
doesn't
How about
help.
the 5th? What about the 5th?
That's election day.
Oh, and we can't do it on election.
Yeah, okay, yeah. Well, move it in December then.
December, I
I
don't
don't
have
think
some
we do
things.
it.
Unless
26.
26 would be bad for people, right?
Yeah, because it's Thanksgiving week.
Yeah,
I know, I'll be prepping for a lot of people.
yeah.
I do multiple Thanksgivings. Let's see. I can do December 3rd, but the next 2 weeks I'm at back-to-back conferences out of town.
Third works for me.
December
Yeah.
3rd.
This moment it works for me.
December 3rd, going. What do you, I'm gonna do what you said, where are you going for 3 or 4 weeks?
I'm gonna be in Louisiana
Oh, that sounds like fun.
for like 14 days.
Wow.
And then, of course, I officiated high school basketball.
Oh, that's cool.
And so once we get into November, December on, it's kind of locked up for most of the
Thank you very much, because I'm sure that is a great.
things. Yeah, I mean, I'd rather come here, actually. Nobody yells at me here.
Definitely was officiating that evening, Kathy. He would rather be here, he says, but he's already committed. He's already committed to the position. So we will be thinking of him while we're all here and hoping he's not being yelled at. All right, so Tuesday, December 3rd, so we'll move November 19th, going. Everybody good? We're moving that to December 3rd. Same bat time, same bat channel. Again, I'm like too. None of the kids that I teach get any of my references. When they don't let me know how old they are, they look at you like.
Every time I go to present at U of I always say the term VD. The public health was started to get rid of
Oh.
VD, and then I just stare at them, I'm like, does anybody know what VD is? And I've just watched the curve over the years go down. There's literally none. Now not even the professors know what the heck I'm talking about. I'm just like,
Oh, that's shocking.
mm-hmm.
It blew my mind today. I gave a presentation and I used the term rubber stamp, like somebody has to put their rubber stamp on it. And I got feedback from one of our nurse managers that the nurse supervisor was like, what does that mean? I'm
The
like, are you
nurse
serious?
supervisor. If any, of anyone, nurse
Yeah.
supervisor, doesn't know what a rubber
She's just
stamp
saying,
is.
yeah.
Somebody the other day said to me that what does that mean? It's not your ballywick. What does that mean? I'm like, wheelhouse, for God's sake. Oh, they knew that one.
I did have a student last spring ask me on a test what lukewarm was.
What the heck?
Yeah, lukewarm. So it is. It's just it's a different thing. It's like Gen Z. I'm learning. But they've got so much slang that I got.
I was gonna say they say stuff all the time, and I'm like,
Which
No.
is mainly emoji talk, and I've gotta be like, okay, what does this emoji mean and this series of letters now mean? And-
Yeah.
LOL, I did it for a while.
That shows how old he is. I don't know
Yes.
if this is the right time, but I would like to put on maybe the next agenda meeting, especially if it's in December, an update on the senior needs.
Oh, yes,
All
absolutely.
our studies done, and
Yeah.
do I need to send a special request for that, or can I just
No,
bring it
we
up?
got it, Amy's got it.
Okay.
She is amazing, she's way ahead of us. All right, December 3rd, see everyone there, I need a motion to adjourn. Move to adjourn, do I have a second?
Second.
Moved and seconded, any discussion? Hearing none, all those in favor?
Aye.
Anyone
Time for
opposed?
must-see
All right.
TV.
I have
Thanks,
something to
Kathy.
give you if you
Yeah,
want it.
thanks for
Okay.
coming.
It's in my car.
Okay, so I need to add your mark?
Yeah.